Don't forget to like the video and subscribe. Thank you, I appreciate you.
Good evening, everyone. My name is Dr. Samit. I am a senior consultant urologist, transplant surgeon, and robotic surgeon at Max Hospital, Saket, New Delhi. Today, we are going to talk about management of BPH. So, in this discussion, first I will be briefing you about what is prostate, how it functions, how it enlarges, and what are the treatment options. And at the later half, once I finish my talk, we will take questions one by one. So we need to understand prostate is a male sexual gland, okay, which helps in formation of semen. जो semen बनता है उसमें help करता है prostate. Now, where is it situated in the body? Body में कहाँ होता है? Suppose this is bladder and this is the urine passage that is coming out. Prostate is around the urine passage, all around like a donut. Okay. So whenever it enlarges, it may compress the urine tube and it can lead to symptoms. Now, the function of prostate, as I have told you before, is to help in formation of semen. And when it enlarges, it can lead to obstruction in the urinary passage. Now, what are, if we talk about BPH, BPH is called benign prostatic hyperplasia. That suggests that it is benign. इसका मतलब ये it is not cancerous. It is enlargement of prostate. So benign prostatic hyperplasia. Now benign benign prostatic hyperplasia is a histopathological diagnosis. When you send a biopsy or you send a tissue after surgery, the histopathologist will tell that it is a benign hyperplasia. But in simple terms, when we use is we call enlargement of prostate, or we say that we have prostatism, we have prostate enlargement. Now, when the prostate, the histopathological evidence of benign prostatic enlargement will be seen after the age of 50 in many people. Okay, it is quite normal that with advancing age, the prostate will enlarge histopathologically. So about in more than 50% of people who are above 50 or 60% of people who are above 60, the enlargement of prostate will be there. But in only 50% of people, 50% of the times, it will show symptoms. Okay. So as we age, as the age is advanced, the chances becomes more and more that you will have enlargement of prostate and you will become symptomatic about your urination. Now, what symptoms to expect? When do you say that your prostate is enlarged? So, prostatic symptoms can be of two types. One, it can be because of the storage, because it affects the storage symptom of bladder. The storage symptoms are when you have frequency, that means you have to go to the washroom again and again, many times, multiple times. Or you have nocturia, that means you have to get up in the night multiple times to pass urine only, it disturbs your sleep. Or you have urgency, that means you have strong desire to pass urine which you cannot hold. Okay. Or it can be voiding symptoms because of the obstruction that the enlargement of prostate creates. That is when your stream goes weak, जिसको हम साधारण भाषा में कहते हैं कि पेशाब का धार कम हो गया. Okay. When you have to strain to pass urine. Okay. So these are the symptoms. When you have these symptoms, you know that yes, your prostate is getting enlarged and you need to do something about it. So whenever you have these, very rarely it happens that you have only one symptom. Most of the time it is that you have multiple symptoms. Okay. that means you have frequency also. In the night time also you need to get up, you can't hold or you can't empty your bladder fully. So when these symptoms are seen, that is the time when you should go and visit a urologist. Okay, so when you go to a urologist, what is to be expected? What he will do is he will ask you history. Okay, and the more important thing that need to consider when you have all these symptoms is the other illnesses that you have. If you have diabetes, then naturally because of the high sugars you may have frequent urination. So in there, when you visit a doctor, it is important that you tell him about all the previous illnesses that you have, or there are many medicines which when you take can lead to increased urinations like diuretics, okay, which reduce water inside your body, especially cardiac patients or kidney patients are on these. So drug history is very important. So you need to tell your doctor what problems you have had in the past or currently having, what illnesses you have, and what medicines are you on. That will help the doctor treat you better. So once he's taken your history and he has the suspicion that yes, you have the symptoms because of the prostate only, he'll advise you some tests. Okay, so the basic tests that he is going to advise you is urine routine and culture test to see for any infection, a kidney function to see whether your kidneys are functioning well. One thing that you hear a lot about is a test called PSA, that is prostate specific antigen. That test helps us to a certain extent differentiate between the benign enlargement, non-cancerous enlargement, and cancerous enlargement of the prostate. Okay, so PSA will be ordered. Now after apart from PSA, you need to have an ultrasound which will tell you about the kidneys, about the bladder, how thick the bladder walls are, because that will tell us how much force the bladder has to apply against the prostate, how much the prostate is enlarged, the size. Okay, and a urine flow test where you have to stand or sit in a machine and pass urine. Okay, that will tell us how much is the flow, how much obstruction it is causing, and how much residual urine करने के बाद में यूरिन कितना अंदर रह गया है ब्लैडर में, that is also important. So once he does all these tests and he tells you that yes, your PSA is normal, so your chances of having a malignancy are less, there's no urine infection, your kidney function are fine, your prostate is enlarged and there is a block in the flow, then that is the time then you need to discuss what are my options, what I can do to alleviate these symptoms, इसका इलाज क्या है. Okay, so the first and foremost treatment option that we have, and that is often ignored. जब भी आप किसी डॉक्टर के पास, यूरोलॉजिस्ट के पास जाते हैं, you are expecting him to give you medicine or do some trick or surgery so that you are treated. But let me tell you, the most important and first step in treating prostate is lifestyle modification. Now, what are lifestyle modifications? If your sugars are very high, you need to control the sugars. If you are on medications like diuretics, you need to manage them well. Suppose if you have nighttime urination problem and you are taking the diuretic medicine at the night, you need to shift it to morning. Okay, so and you, if suppose you sleep at around 10 o'clock, 2 hours before sleeping you must restrict your fluid intake, and fluid intake includes water, tea, coffee, milk and drinks. Okay, तो सोने के 2 घंटा पहले से आपको ये सारी चीज़ें कम करनी है या बंद करनी है. जो भी whatever you need to drink, you drink it 2 hours before, and before sleeping you go to the washroom, empty your bladder so that you will be able to sleep throughout. Okay, so lifestyle modification is very important. uh, very often we have seen that anybody who has urinary trouble is asked falsely to drink a lot of fluids. Okay, so anybody who has prostatic symptoms, he will also start drinking 4 liters 5 liters urine. तो अगर आपको प्रोस्टेट की प्रॉब्लम है तो आपको ज़्यादा पानी नहीं पीना है. यू डोंट नीड टू ड्रिंक अ लॉट, रादर यू हैव टू curtail your drinks. आपको कम करना है. ओके, not so much so that you have dehydration, but yes, you have to keep on the normal lower side. Okay, lower side of the normal. Now what we do, once we do these lifestyle modifications, about 50% of people will have symptomatic relief. उनके symptoms improve हो जाते हैं, they feel better once they do these lifestyle modifications under the guidance of an expert. But suppose you still have problems and lifestyle modifications are not yielding results that you desired, आपको जितना फायदा चाहिए था वो नहीं हो रहा है, then what you do? Then the doctor will prescribe you medications first. 20 years before there was hardly any medication or very few medications for prostate, and most of them used to land up getting a surgery done for prostate. But over a period of time, there are lot many effective medicines which can take care of the symptoms and to a certain extent reduce the enlargement. So in this group, the first drug that is used is called alpha blockers. What they do is, prostate is like a ball. What they do, and it is made up of glands and muscle tissue. What it does is it reduces the muscular tension and it relaxes the prostate so that the passage that goes through the prostate opens up a little and you get a symptomatic relief. Okay, there are many alpha blockers. You must have heard their names: tamsulosin, silodosin, doxazosin. Okay, the alfuzosin. These are the medicines that are commonly prescribed for the patients who have symptoms because of the prostate. Okay, the other group of drug is called 5-alpha reductase inhibitors. You may know them by the name of dutasteride or finasteride. What these drugs do is that they reduce the hormone levels inside the prostate, and they will take care of the glandular part. They reduce the size of the prostate. But the alpha blockers, which reduce the tension of the muscles, they start acting pretty fast. Okay, in a day or two you will see the symptomatic relief. But the alpha reductase inhibitors like dutasteride, they need at least 3 to 6 months of therapy to show a visible reduction in the size or improvement in symptoms. So they take a longer time. So more commonly than not, what doctors give you is a combination of both the medicines like Duta-St, okay, or Tam, Dura. So the combination of alpha blockers and 5 reductase inhibitors. This is what they do. Okay. Now there are some other class of drugs as well. Some over-the-counter medicines called phytotherapy. They are made up of various naturally occurring herbs, which can be used over the counter. But they have their effectivity is not universal. हर आदमी को उससे फायदा हो ऐसा ज़रूरी नहीं है. But they can also be tried, especially those patients who have side effects with the medications like alpha blockers and 5-alpha reductase inhibitors. So these two drugs are mainly used for the voiding symptoms, okay, obstructive symptoms of the prostate. But sometimes because the bladder keeps on putting pressure, bladder pressure लगाता जाता है prostate के against में, and it becomes irritable over a period of time, and there are irritative symptoms or storage symptoms that we talk about, like frequency, nocturia, urgency. For that there are medicines which can be given either alone or in combination with these medicines that I have prescribed. These are called mirabegron, solifenacin. Okay. These medicines help you to decrease the irritative symptoms, okay? The frequency, the urgency, the night time. There are many more medicines which can only be taken with the with the advice of the expert only. You should not experiment with these medicines at home, or with the advice of a friend you start taking any medicines. Please don't do that. Go to a doctor, get yourself checked and assessed, and then you start treatment. In the in patients who are not benefited by medicines even, they are the candidates who require surgery for prostate. Now, surgery of the prostate can be of many types. Initially, earlier it used to be an open surgery by giving an incision, chira laga ke prostate nikalte the. But that era is now gone, and there are minimally invasive surgeries. Okay, that means surgeries are done through the normal urinary passage. You will have a tube called catheter for 3 days after the surgery, and then you can go home. It takes about 7 to 10 days healing process, and then you can pass urine normally. So who requires surgery? There are some absolute indications for surgery. That means if you have those symptoms, then you have to undergo surgery sooner or later. Those are if you have complete retention of urine. अगर आपका यूरिन रुक जाता है और पाइप डालना पड़ता है. If you have hematuria, अगर बार बार यूरिन में ब्लड आने लगता है. If you have kidney damage because of prostatic enlargement. If you start forming stones, अगर आपके ब्लैडर में stones बनने लगते हैं, okay? अगर आपको बार बार infection होता है, if you get recurrent infection because of the prostate. So these are the symptoms. When you have these repeatedly, you must think about getting the surgery done, and your urologist will advise you so. The surgery, another indication, major indication for surgery nowadays is when you have severe symptoms and it cannot be controlled with medicine. Okay, that also is an indication to undergo a surgical treatment. Now, once you decide to get the surgery done, you must understand that all the surgical treatment of the prostate will lead to retrograde ejaculation. That means the semen will not come out, it will go back in the bladder, and it will be difficult for you to father a child. So those who have the desire to keep the family going need to seriously consult with your doctor before undergoing surgery. Okay. Now, surgery nowadays is routine and pretty simple. You get admitted on the day, we do the surgery, there's no cut involved. The surgery is done through the normal urinary passage. There's a catheter at the end. It remains for 2 to 3 days, and then it is removed, and you will be able to pass urine normally. There may be complications of surgeries that you need to discuss before the surgery with your urologist. So these are the basic things that we need to be aware about the prostate, its enlargement with age, what are the tests that are required, what symptoms you have, when to go to a urologist, and what tests he will advise you, and what treatment options do you have. Now, there are instances when either the PSA is high, or when on clinical examination there is a doubt that the enlargement of prostate is maybe because of any cancer or malignancy, then your doctor will advise you to undergo a procedure called biopsy before we do anything for the prostate. Okay, it's a simple procedure. It is done through the rectum. Okay, it's a day care procedure, and it is done to confirm or rule out the chances of malignancy and the enlargement of prostate because of the malignancy. So if your PSA is high, or if on clinical examination your urologist feel that, oh yes, there is a doubt, then before you start treatment for prostate, we advised biopsy. Okay, so if somebody advise you biopsy, that doesn't mean that he is confirming cancer. That means he just wants to be very clear what are we dealing with. Okay, so that's about it, viewers and friends. uh, I will start taking questions now. So one friend has asked, are there medications that may make my symptoms worse? Yes, as I have told you, that if you are taking medicines like diuretics, or if you are a diabetic and new age diabetic medicine, if you take it in the evening, then yes, there will be a lot of urine production greater than normal. Then you can have worsening of your symptoms. You will have more frequency, more urgency. You will have to get up in the night very frequently. Okay, or if your sugar is not controlled, then also yes, this will add on to the prostatic symptoms and make your life difficult. Another question a friend has asked is, are there exercises that can help with my symptoms? See, if you are a sedentary lifestyle person, that means you don't exercise much, you don't walk, you don't run, or you don't do any kind of exercises, then yes, general well-being of the body is also related to the well-being of the prostate. So you must do exercises. There have been various information in the net regarding a specific exercise called Kegel exercise to improve prostatic symptoms. But it is not a treatment. It can help you in improving your prostatic health if you do those exercises that you've seen on various platforms. Okay, to improve the strength of your pelvic floor muscles. Yes, it can help to a certain extent, especially in people who have prostatic symptoms at a younger age, but not say at the age of 70 or 65 or plus or so. So yes, exercise is good, but no particular exercise you can call it as a treatment कि आपने ये exercise कर ली तो आपकी prostate ठीक हो गई या उसका size कम हो गया या उसके symptoms खत्म हो गए. Not like that, but yes, it helps. Now, Deepak has asked, does BPH lead to erectile dysfunction? See, BPH itself does not lead to problems in erection, but BPH is a symptom or is a disease of elderly, more often seen after the age of 60. So in these group of people, there is already a late onset hypogonadism. That means with age, the male hormone, that is testosterone, goes down, and portions of female hormones like estradiol, their level goes up, and that leads to problems related to erection. BPH per se will not lead to problems in erection, or the treatment of BPH also, either medicines or surgery, will not decrease your libido. That means your desire to have sex will not be affected that much, but you will have, with the medicines or with the surgery, you will have retrograde ejaculation that I talked about. One group of drug called alpha reductase inhibitor, which reduces the size because of reduction in the hormone levels, may in some patients lead to reduced libido, but it is not universal, and it takes a very long time for the libido to go down once you are on these medicines. So I hope that answers your questions. But BPH per se will not lead to problems in erection. Now, Jennifer asked, what are the long-term risks of BPH? See, we must understand that BPH is specifically, we are talking about an entity that is called benign prostatic hyperplasia. That means it is benign. It's a histological term. Prostatic enlargement may be because of benign enlargement related to age that we are talking about. It may be because of the infections in the prostate. It may be because of cancer in the prostate. Okay, so it is not like that if you have prostatic enlargement, it can turn into cancer if you don't get it treated. No, it is not like that. But with the age, as the chances of benign enlargement of prostate increases, so does the chances of getting malignancy in the prostate. Okay, so if we take out tissues for examination of say a 70-80-year-old, you may find a small focus of malignancy that may not necessarily cause any harm to you, okay, in your lifetime. So BPH per se does not lead to cancer, but yes, they can coexist. You can have benign enlargement of prostate, which later can develop over a certain period of time, can have a malignancy also. Now, the risks that BPH can have is that I have talked about. You can have symptoms which can trouble you. Okay, that you are looking for washrooms everywhere. You can't go out because you fear that you will have problems, you will have urgency. Okay, you can't sleep well at night. So apart from these problems, you can have infections, a lot of infections, urine infections, if your bladder is not able to empty fully because of the prostate enlargement. You can have stone formation if it is neglected. It can lead to kidney damage if you are not vigilant or not keen. Okay, or you can have complete cessation of urine. That is called acute retention. You will not be able to pass urine. Your bladder will keep on filling. You will have pain, and ultimately you will have to go to a hospital to put in a catheter and relieve you. So with benign prostatic enlargement, these are the risk factors that you have. Now, Amitesh is asking, what is the main risk of BPH? The main risk of BPH is when we go into the stage of complications, stone formation, retention, kidney damage, stone formation, recurrent urine infection, bleeding in the urine. Okay, these are the risks that you can have, you can expect if you don't get it evaluated or treated. So untreated BPH can end up in having these complications. Chandni ji has asked, what minimally invasive treatment is available for BPH? Okay, so if suppose the drug is not working and we need to operate, so the surgery is usually done within through the normal urinary passage. We have special endoscopes. Now when we reach inside at the level of the prostate, we can cut the prostate from the inside using either an electric therapy, that is called TURP, transurethral resection of prostate. Okay, if we are not using electric current and we use novel methods, advanced methods called lasers to cut the prostate from the inside or to evaporate it, that is called laser prostatectomy. These lasers are of different types. Okay, you can have a holmium laser, you can have a thulium laser, you can have diode laser. So various lasers are used to cut the prostate from the inside. The basic treatment is cutting. Okay, so these are the most common minimally invasive treatment that is used. Apart from that, if suppose the prostate is enlarged quite a lot, more than 100-200 grams, then we use robot to treat these. What we do is we make 4 holes on the abdomen, on the tummy, and through there we go in and we remove the large prostate, because such large prostate, more than 150 or 200 grams, are difficult to remove through the normal urinary passage, okay, because it will take a lot of time. So you can use robot. There are stents available. These are short tubes, so you place it inside the urethra, and that will give you a passage for urine to pass, but that is used only for elderly people who are not fit for any anesthesia or any surgery. We use stents. There are newer methods coming called water ablation, water jets, and so on and so forth, uh, which can also be done in minimally invasive fashion. But the basic principle of these is the same. We go through the normal urinary passage with an endoscope. The energy that we use may differ in patient to patient or in different modalities, but that is the basic aim. Uh, One more friend has asked what complications can BPH cause, as we have discussed earlier. Bleeding, infection, stone formation, kidney damage, retention of urine. All right. Uh, Another friend has asked, is there any role of pelvic floor exercises in BPH? Yes, there is a role, but it is supportive to the lifestyle modification or the medicines that you take. Alone, it can rarely produce the desired result. It is used to improve the prostatic health. You know, when you exercise, the blood flow increases, the infection is taken care of, the inflammatory markers that are inside the prostate because of inflammation, they are reduced, so the prostatic health is improved. So yes, it helps, but it is not the treatment. You must understand this, and you must go to a urologist, discuss these things. Don't do it on your own by watching it on different platforms on the net. Consult your urologist. uh, Somebody has asked what makes BPH worst. So, see, benign prostatic enlargement is an age related uh, process. With your advancing age, the prostate is going to enlarge. In some, it will not enlarge with that rapidity and will not produce any symptoms. So, we are okay there. But in those who are having symptoms because of the prostatic enlargement, with age, with continuous enlargement, you may have increasing symptoms. And if you don't take treatment, if you don't do lifestyle modifications, if you don't take medications, then yes, slowly and slowly your problem is going to go from bad to worse. What you can do is you can modify your lifestyle. You can start exercising. You limit your fluid intake, especially in the evenings. You, if you have any diseases like diabetes, you control them well. You get a review of your medicines with the doctor, with the urologist, that these are the medicines. Do I need to, make any changes to improve my symptoms? And the medicines you need to continue taking. Don't stop or don't experiment without the advice of the doctor. Otherwise, your symptoms will go from bad to worse. Are there any exercises that can help to overcome this problem? I've told you, we have discussed the Kegel exercises. Amisha asks, is it hereditary? Yes, a very good question. See, enlargement of prostate to a certain extent is hereditary. Yes, we have seen that patients whose fathers or elder brothers have prostatic enlargement, especially at a younger age, and they had treatment, either medicine or surgery, especially at a younger age like 50s or 60s, they tend to have prostatic enlargement more as compared to the general population. So yes, hereditary plays a role, and hereditary or genetic factors play a role, especially in cancer prostate. If you have anybody in your family in first degree relations, like your father, your brother, okay, or your uncle, has had prostatic enlargement because of the cancer, yes, you are at a higher risk, and you should go to a urologist at the age of 45 or 50 and ask him to screen you properly, so that we can find if there is anything a problem at an appropriate early stage. And there are very good treatments with very good results for early stage prostate cancer. If done in time, they can save your life and prolong your life. So yes, heredity has a role in enlargement of prostate. It cannot be denied. So those who have history of family members with enlarged prostate need to be more careful and need to seek advice early. uh, Suruchi has asked that apart from BPH and prostate cancer, what are other non-cancerous prostate problems? See, the most common problem is infections in the prostate. Okay, in males, especially after say their young age, once they go into their 40s or 50s, they are prone to have infection in the prostate that is called prostatitis. Okay, it can be because of most commonly a bacterial infection, but sometimes it may trigger by an infection, and then later on there are inflammatory mediators inside the prostate which can keep the inflammation going inside the prostate without having infection. So that is called non-bacterial prostatitis. Okay, one is bacterial prostatitis because of the bacterial infection which can be treated by antibiotics. The other is called non-bacterial prostatitis, which require long-term treatment. Okay, it is difficult to diagnose. So if you go to a doctor, you have symptoms like I have discussed: frequency, urgency, pain. Then on evaluation, if the urine says that there's no infection, but still you have those symptoms, especially at the younger age group, then you must be evaluated for chronic prostatitis, which is a very debilitating problem. It can lead to a lot of pain, a lot of urinary symptoms, difficult to diagnose. You go to a urologist. If a urologist is not accustomed to seeing these, not experienced enough, he can give you a lot of antibiotics for a long period of time, but your problem still persists. So you need to get treated for these things as well. So prostatitis, sometimes the infection becomes so overwhelming that you can form an abscess. Okay, there a ball of pus is formed inside the prostate which will require drainage. Sometimes there are congenital abnormalities like cysts that you can see inside the prostate. Most of the time they don't trouble you, but if they become large enough, yes, it also requires treatment, mostly surgical. There are various infections like tuberculosis. In the old days, now it is becoming less common, but yes, this can also lead to tubercular prostatitis, and you can have problems because of that as well. The next question is by Savitri Kashyap. Any dietary advice suggested for this problem? You can, there's no particular diet that you take for the treatment of prostate, but yes, you need to modify your lifestyle. As I've told you, you reduce the evening fluids. Okay, you manage your medications, you take healthy diet. Okay, uh, it doesn't matter whether you are a vegetarian or a non-vegetarian. It hardly matters as far as benign prostatic enlargement is concerned. So that is it. And somebody has asked, what should be included in the history and physical examination in men with symptoms suggesting BPH? Yes, good question. Uh, See, when you go to a doctor, in history, the most important thing is the detailed history of the urinary symptoms. Okay, frequency. You ask a lot of questions. You have to spend a lot of time with the patient. You have to ask them about the frequency, whether daytime or nighttime. Okay, whether he has urgency, whether how do you inquire urgency. You need to ask whether he can hold urine when he is doing something important, or he needs to stop everything and go rush to the loo. Okay, you need to ask about incontinence, whether when he's rushing to the loo he leaks urine a bit or not. So you have to have detailed history of these symptoms. Okay, once you have the detailed history of symptoms, you must ask them about their past history, about any other medical condition like diabetes or blood pressure or heart failure. Okay, what medicines they are on for those which can affect the urinary system. You need to ask whether they have undergone any surgery or any medications for their urinary symptoms or not. More often than not, you will see that they have already been under treatment uh, in between, stop and start. When the symptoms improve, they tend to stop and then they restart again. So don't do that without the advice. In examination, you must examine the abdomen, very well focused abdominal examination. You must examine the external genitalia very well. Sometimes patient comes with the history of obstructive voiding and you fail to examine and the patient has phimosis, where the foreskin over the penis does not open up well. And if you treat that phimosis by a simple surgery in local anesthesia called circumcision, the symptoms are relieved. Okay, otherwise you would have unnecessarily been treating that patient for prostate and thinking that why he's not responding. So examination of abdomen, examination of genitalia, and most important thing is the digital rectal examination. You must not omit digital rectal examination, even though we have a lot of investigations like PSA or MRIs and CTs and PSMA PETs and whatnot to decide whether the prostate is prostate enlargement is because of malignancy or not. But you must do a proper digital rectal examination. It's a rectal examination where you use your index finger to feel the posterior surface of the prostate, which is in front of the rectum. That will give you a rough idea about the size of the prostate, its mobility, whether there is any nodularity or whether it is stuck to the surrounding structures or not. So in these patients, it is very important to do a digital rectal examination. So three main things: abdominal examination, genitalia, and DRE. Okay, digital rectal examination. These are to be done and these are a must. Mr. Malviya has asked me whether which type of medical therapy are suggested in the treatment of BPH. As I have told you before, most common drugs that are used for enlargement of prostate are called alpha blockers. Okay, what they do is they relax the smooth muscles inside the prostate, and that relaxation leads to a reduced tone in the urinary passage and leads to better flow. These are called alpha blockers. Most common alpha blockers that are used are tamsulosin, by the name of Urimax, you see. Okay, then alfuzosin, doxazosin. So these are commonly used alpha blockers in the treatment of prostatic enlargement. And apart from that, you use 5-alpha reductase inhibitors, which are dutasteride and finasteride, which leads to reduction in the size of the prostate gland. Okay, they reduce the hormone level. By doing so, they reduce the glandular component, and once the glands are small or they are atrophied, the size of the prostate also goes down. So these are called alpha reductase, 5 alpha reductase inhibitors. Apart from that, for storage symptoms like irritative symptoms, we use medicines that are called anticholinergics or antimuscarinics, which reduce the irritability of the bladder. Okay, it does not contract again and again, so that you don't feel to go to the loo frequently. Uh, these come with the name like solifenacin, derifenacin. Okay, uh, newer drugs, beta adrenergic agonist called mirabegron also is used quite frequently nowadays. Uh, Sometimes we use less frequently used drugs uh, in the treatment of prostate. Like if the irritability is pretty high, then we use Botox injections inside the bladder. Or sometimes we use medicines that can lead other medicines to relax the smooth muscles called sildenafil and tadalafil also, which helps a lot. Uh, Another person, Vikas, has asked, can prostate go further after the surgery? Very good question. Uh, we tell our patients that if we do surgery in 100, after 10 to 13 years, 7 out of 10 may have further regrowing of the prostate. Okay, so the chances are very less because it is usually the disease of elderly. So if suppose you have surgery at the age of 70 or 75, uh, out of 100 patients, only 7 may require treatment for enlarged prostate after 10 to 13 years. Okay, so it's a pretty low number, but it is more often seen in those who have prostatic enlargement at an early age. Suppose at 55 or 60 you have prostatic enlargement, then yes, after 10-15 years you may have regrowth. When you have regrowth of the prostate, when you start having prostatic symptoms 10-15 years down the line after the surgery for prostate, then we the treatment algorithm is more or less the same. You start with lifestyle modifications and medicines, which takes care of the symptoms in 50% of the patient. Okay, and rest sometimes may require very small group may require another surgery. Now, the chances of resurgery as far as it goes also depends on the previous surgery that was done. You must understand, if the previous surgery is done well, the sufficient amount of prostate has been removed, then the chances of regrowth leading to problems or symptoms they go down. But suppose if the initial